Patient portals and the role of EHRs in promoting patient access to their health data. Patient portals. Definition: a patient portal is a secure online platform that allows patients to access their health information, communicate with their healthcare providers, schedule appointments, request prescription refills, and view lab results, all through an EHR system. Promoting access. EHRs enable patients to have real-time access to their health data, empowering them to track their medical history, medications, allergies, immunizations, and test results. This transparency fosters trust between patients and healthcare providers and gives patients more control over their health decisions. Enhancing communication. Through patient portals, patients can easily communicate with their healthcare providers, ask questions, and clarify doubts without having to schedule an in-person visit. This direct communication encourages patients to be more involved in their care, improving their engagement with the healthcare process. Benefits of patient portals. Increased patient autonomy. Having 24/7 access to their medical records allows patients to make informed decisions, understand their treatment options, and engage in their care in a more meaningful way. Convenience and accessibility. With the ability to access their records online, patients no longer have to wait for physical copies of their medical documents or rely on phone calls to communicate with their provider. Improved health outcomes. Patients who actively engage with their health data are more likely to follow through on treatment plans, track chronic conditions, and make healthier lifestyle choices, leading to improved long-term health outcomes. How EHRs facilitate shared decision-making and patient education. Shared decision-making. Real-time data. Access. EHRs allow healthcare providers and patients to review the same information during appointments, which facilitates shared decision-making. For instance, a doctor and patient can review lab results, treatment options, and potential risks together, allowing the patient to actively participate in choosing the best course of action. Decision support tools. Many EHR systems integrate clinical decision support tools, CDS, that provide evidence-based guidelines and treatment suggestions. These tools help both providers and patients make informed choices, considering factors such as the patient's health history, preferences, and clinical guidelines. Improved communication. EHRs facilitate open communication during consultations. By displaying relevant medical data in an easy-to-understand format, patients can better grasp their health condition and participate meaningfully in decisions regarding their care. Patient education. Personalized education. EHRs enable providers to deliver personalized educational resources directly to patients through the patient portal. For example, a patient diagnosed with diabetes can be provided with tailored educational materials on diet, exercise, and medication management. Evidence-based resources. Providers can access evidence-based educational materials within the EHR and share them with patients during consultations. This empowers patients with the knowledge they need to understand their condition and treatment options, promoting more informed decision-making. Preventive care education. Through patient education, features in EHRs, healthcare providers can educate patients about preventive measures, such as vaccinations, screenings, and lifestyle changes that are essential for maintaining health and preventing disease. Engaging patients in preventive care. Through EHR reminders and alerts, automated reminders, vaccinations and screenings, EHRs can be programmed to generate automatic reminders for patients to receive preventive care services, such as annual screenings, e.g., mammograms, colonoscopies, or vaccinations, e.g., flu shots. These reminders help ensure that patients stay up to date with preventive care, reducing the risk of developing chronic conditions or diseases. Chronic disease. Management. EHRs can help manage preventive care for patients with chronic conditions by sending reminders for regular checkups, lab tests, e.g., cholesterol, blood glucose, or medication refills. These reminders help patients maintain ongoing monitoring and prevent complications. Clinical alerts. Health risk. Alerts. EHRs can generate alerts when there is a concern about a patient's health, such as a significant change in vital signs, lab results, or medication interactions. These alerts notify both patients and healthcare providers, prompting necessary follow-up care. Alert customization. Alerts can be tailored to the specific needs of individual patients, whether related to preventive measures, medication adherence, or upcoming appointments. By notifying patients and providers in real time, EHR alerts help ensure that critical health information is acted upon promptly. Behavioral health support. EHR systems can also generate behavioral health alerts, such as those related to mental health screening or wellness check-ins, encouraging patients to stay engaged with their mental and emotional well-being. Engagement with health goals. Tracking. Progress. EHRs can help track patient progress toward health goals, such as weight loss, smoking cessation, or blood pressure control. By setting health goals within the EHR, patients and providers can monitor improvements over time and celebrate milestones, reinforcing the patient's commitment to their health journey. Personalized preventive care plans. EHR systems allow healthcare providers to create individualized preventive care plans for patients, taking into account their unique health needs, family history, and risk factors. This personalized approach encourages patients to take proactive steps in managing their health, leading to better engagement in preventive care. EHRs for Clinical Decision Support, CDS. Clinical Decision Support, CDS, refers to tools and features within electronic health records, EHR systems, that assist healthcare providers in making informed, evidence-based clinical decisions. These tools help clinicians by integrating real-time patient data with evidence-based guidelines, alerting them to potential risks, and suggesting appropriate actions to improve patient outcomes. The integration of CDS into EHR systems has revolutionized clinical decision-making, enhancing patient safety, reducing errors, and supporting efficient, high-quality care. How EHRs improve clinical decision-making with alerts, drug-drug interaction checks, and evidence-based guidelines. Alerts and notifications. Real-time alerts. EHRs provide real-time alerts to healthcare providers about potential clinical issues, such as abnormal lab results, drug allergies, or adverse reactions. These alerts are designed to catch critical events, such as the risk of medication errors or life-threatening conditions, ensuring timely intervention. Critical event notifications. Alerts can notify providers when a patient's condition changes unexpectedly, such as a sudden increase in vital signs or a lab test result outside of normal ranges. This allows providers to take immediate corrective action. Timing and customization of alerts. The frequency and relevance of alerts can be customized, ensuring that providers are not overwhelmed with non-critical notifications. Effective alert management improves decision-making by focusing attention on the most urgent or clinically significant concerns. Drug-drug interaction checks. Medications and interactions. One of the most valuable CDS functions within EHRS is the ability to check for potential drug-drug interactions, DDIS. EHRs cross-reference a patient's active medications with databases of known drug interactions, providing alerts when a potentially harmful combination is prescribed. Preventing adverse drug events, ADEs. By highlighting interactions between medications, EHRs help prevent adverse drug events, which can lead to serious complications, hospitalization, or even death. These checks also include warnings about duplicate therapies, contraindications, and dosing errors. Real-time recommendations. When a potentially harmful drug combination is identified, EHRs provide recommendations, such as alternative medications or adjusting dosages, based on clinical guidelines and patient-specific factors. Evidence-based guidelines. Clinical guidelines. Integration. EHRs integrate evidence-based clinical guidelines into the workflow, helping clinicians make decisions that are consistent with the latest research and best practices. These guidelines can pertain to the diagnosis, treatment plans, preventive measures, and management of various diseases and conditions. Guideline adherence. EHRs can prompt providers to follow these guidelines by providing alerts or suggesting appropriate actions, e.g., prescribing a recommended medication or ordering a necessary diagnostic test based on patient data. This helps to standardize care and reduce practice variations. Patient-specific adjustments. The EHR adjusts recommendations based on the patient's individual clinical history, including comorbidities, allergies, and risk factors. This personalized approach ensures that guidelines are followed in a way that is specific to the patient's needs.